Hello, thank you for your interest in the Infectious Disease Fellowship at UW. I'm excited to talk to you today about the Public Health HIV STI Research Group here. My name is Julie Dombrowski. I'm a professor of medicine at the UW and deputy director of our county HIV STI hepatitis C program. One thing that is really special about ID training at the UW is our long-standing public health academic integration. This goes back to 1978 when the Sexual Health Clinic, or what's now called the Sexual Health Clinic, was created, and King Holmes really led the charge in integrating the public health and university to manage that clinic. That has really produced over time a lot of scientific leadership in STI research, and faculty and trainees over time helped define emerging STI pathogens and syndromes, including chlamydia trachomatis, HSV, HPV, non-gonococcal urethritis, and BV. In 2010, the public health program integrated HIV and STI, and more recently integrated hepatitis C. And the scientific leadership in the public health program, which includes UW faculty members, has really facilitated excellent program science and implementation research. This includes an expertise in particular on HIV, STI clinical and public health services in the US, and that includes syringe services programs. The past trainees from our program are really illustrative and bragworthy and shown here. So everyone shown on this slide, many of whom you probably recognize, but names at the bottom, trained at UW and have gone on to carry a lot of their training expertise into the world, with especially scientific impacts in the arena of HIV, STIs, and sexual health. There are several related research institutes and centers at the UW that also bring opportunities for training and for mentoring. Those include the UW Center for AIDS and STD, the UW Fred Hutch CFAR, the Behavioral Health and HIV Research Center called Birch, and the University of Washington STD Prevention Training Center, an educational center funded by CDC. Our current group and faculty in the infectious diseases division are shown on this slide. That includes Matt Golden, myself, Meena Ramchandani, and Chase Cannon, many of whom you will likely meet during your interview day. As well, epidemiologists such as Sarah Glick and Roxanne Karani, both of whom are faculty members at UW, Jennifer Balkas, who is now in public health leading the surveillance program for HIV, STI, and hepatitis C, Christine Kosrapor, and Lisa Manhart. Eso Soge is one of the laboratory scientists with special expertise in Neisseria gonorrhea, who is also a member of our research group and in the Department of Global Health. The training mission and components of the training can really be tailored for your interests and for the opportunities that exist here at UW. We have a specific interest in preparing trainees to work at the intersection of research and public health practice. In particular, those who are interested in public health HIV STI program leadership. There I'm talking about health department HIV STI programs, which are in great need of excellent medical and scientific leadership around the country. These positions can be integrated with academia, and often these positions require some effort to create the position, which can be done with your mentors. And several of our past trainees have gone on to prominent roles in HIV STI public health at the institutional, city and state, and federal level, all of whom are shown here. Key components of training in our group include exposure to STD clinic operations, surveillance and field services, development of epidemiologic and biostat skills, analysis and interpretation of surveillance data, public health evaluation, and prospective data collection. We have a number of opportunities for an MPH practicum. So whether you are a fellow primarily working with our group or a fellow working with another primary mentor but doing an MPH, we certainly have circumscribed projects for a thesis or a practicum that we'd be happy to talk with you about. Some of the examples of projects people have done in the past are shown here on this slide. We have several areas of active research, and these are often evolving. So we look forward to talking with you individually about opportunities that are likely to come up or arise when you are starting the research portion of your fellowship. Those include syphilis diagnostics, clinical trials, a focus on HIV and STI partner services, both domestically and internationally, mobile clinical services and jail transitional care coordination for people with HIV, integration of mental health and HIV services, and teleprep. So what makes UW a special place for public health HIV STI research? First and foremost, the people. We really have dedicated mentors in our group and excellent colleagues. The extent of public health integration is unique at UW. There are a number of universities that have excellent relationships with our health departments, but I would say that it is unusual to have a truly integrated and, for instance, co-managed STI clinic. We have decades-long continuously funded STD AIDS T32 training grant. That's what funds the research portion of the fellowship. A national and international network of collaborators and collaborations also throughout the university in many different departments. So thank you so much for your interest, and we look forward to hosting you at UW for the interview day.